Okay, so this next technique that I'm going to do with Jacobs, I have him laying on the right side, and he's actually exposing this leg so that way I have access to the calcaneus and to the midfoot, because that's essentially where I'm going to be applying a lot of the directed mobility work, okay? Now, go back and reference your joint mobilization technique so that way you are comfortable with grade 1, grade 2, grade 3, and grade 4, and essentially what those things are to be used with whatever you're trying to achieve in this technique, okay? Now, I have them set up with a towel just so that way it's comfortable. So now what I'm gonna do is I'm gonna go ahead and position where I want my thigh to promote dorsiflexion, my left hand over the metatarsals to promote forefoot inversion, and then I'm gonna take my right hand and I'm going to put it right here on the calcaneus. Now, this is going to be a lateral glide. In traditional orthopedics, lateral glide is going to promote calcaneal inversion. But I'm going to make some slight modifications to this because I want to promote pronation, okay? So I've got them supported right here. I have my thigh to promote that dorsiflexion right here. I'm going to take my left hand around the metatarsals to promote forefoot inversion. And then I'm going to take that calcaneus down towards the ground, guiding it. And clinicians, use your clinical judgment regarding your mobilization principles. I'm going to go into the movement, dorsiflexion, forefoot inversion, calcaneal lateral glide. I can do 5 or 6 reps just like that. Sustain if you want to, and repeat. Okay, so now that you're comfortable with the position and your placement of your leg and your hands, then the next question should be, well, how much force do I really need to apply? Where's the patient? Where should they feel this? What are some things to expect? So let me walk you through that process. I'm going into dorsiflexion by gently moving forward with my thigh. I'm in a staggered stance just for biomechanical principles. I don't want to put strain through my body. And so if I go into dorsiflexion here, first thing could happen is if they have a pinch right here, at the true ankle joint, the talocrural joint, then you may need to do a little bit more talocrural mobilizations just to clear out that joint capsule and to clear out that joint. But if they're not having any issues there, then it would be well expected for them to feel a stretch through the triceps surae, that's the gastrocnemius, and that's the soleus and Achilles area, and that's totally normal, okay? The other thing is, right here in the forefoot, as you're going into that position, you have a plantar fascia that comes off the medial tubercle of the calcaneus, and it goes to all of your phalanges right here at the metatarsals. If you feel a stretch through that plantar fascia, that's okay, because there's a little bit more stretch and a little bit more heavy-handedness that has to occur to achieve what you're getting here, okay? So I have him in dorsiflexion right here. I'm going to go ahead and take that forefoot into inversion, and I'm going to take that calcaneus and do a lateral glide. So the direction that I'm moving with the foot is in dorsiflexion, and it may require a little bit more pressure through your thigh, so that way they feel an adequate stretch through the gastroc and the soleus, adequate stretch through the plantar fascia. So this may not be a lighter handed technique. This may be a heavier handed technique, and you can always ask for feedback from the patients as well of what they're sensing.